Hi, Dr. Peter Montgomery, family practice doctor, giving another COVID update for all my friends and family and patients who are watching. It is April 4th. It is Saturday. Our governor yesterday announced that he is going to do a statewide lockdown order starting Monday. I'm not sure why they didn't do it Saturday. I think he wanted to give people time to shop and get things ready, prepared if they haven't already this weekend. The virus is picking up steam here in Missouri, and so we are doing what we can to try and flatten the curve and keep our healthcare resources able to handle the wave of patients as it comes in. The fevers spiked. I'll go to the weather map in a little bit. The fever spiked over a week ago, but then there's about a 5 to up to 14-day delay from the time of infection and actually running the fever and actually seeking help. So that's going to pretty much happen this week. Our system has developed certain sites to be swell clinics and some clinics to be fever clinics, or people who are sick or having upper respiratory symptoms, so we can, because the flu is still going around and there's other seasonal things going on. And so we want to make sure we're taking care of all the people with their regular medical health care that needs regular checkup and maintenance, and make sure that we're getting the sick people evaluated, see what they have to ease their fear, and see if we can expedite testing. So I'm going to go now to the U.S. weather map brought to us by Kinza. Here's the national temperature weather map, if you will, brought to us by a company called Kinza. They make a thermometer that hooks up to the internet, and this is pretty much everybody's temperatures right now, pretty much in the very low section, mild in here, so it gives kind of an overall view. But the more useful view is looking at the atypical fevers that are higher than they should be for this time of year. The epicenter of the nation has been New York. And looking on that, we can see they had a terrible peak here, a very large, wide peak. The base of it was rather wide, which is a curve there. The temperatures started to rise again, and they got back on it, knocking it down. Manhattan here, Queens County, Kings County, Staten Island, and right up here the Bronx, all that makes up New York City, and they're all had a very high peak and they're coming down. Boston is this area up over here. They're below national average already, so they got ahead of it, and they were able to keep the peak down pretty good there. They've updated their website to have that button to go back to the national. Things have been pretty bad here in Miami-Dade. They had a very high, narrow peak, not as much social distancing going on during the spring break time there. Orange County, that's Disneyland area, Tampa Bay, St. Peter's area up here at Daytona, all rather high, but getting down, finally heading steadily down, hopefully below national average. National average is the blue dotted line here with the range in there. Going back up to Atlanta, I like going to Atlanta because that's the home of the CDC. See how they've been doing. They flattened the curve very well. They're keeping it down. They got it down. Seems to even off. It's hard to get further down, but it can be done. Detroit, still heading down further. Chicago, Cook County, Illinois is Chicago. They got it down. Doing a good job there. Here in St. Louis, where we're at, we didn't have a big peak. We got it down pretty quick. Our hospitals so far are not swamped. We are definitely seeing the COVID. We are definitely having people in the ICUs, and we are having people dying of it in the state of Missouri and even in our county. So far, the numbers have not been overwhelming, but we're ready for a surge. Houston area, Dallas area there. And I'll get back to my family with that in a few seconds. Los Angeles County, keeping it cooler than cool. They're way down there. The whole Southern California is doing a good job. San Francisco, also keeping it cool. So nationwide, I think we're doing a good job of getting it down. The social distancing is working nationwide as far as temperatures going down. Our testing is improving. steadily every day. We're doing 100,000 a day nationally. That's over 120,000 the past couple days. The backlog of tests is getting caught up. I'm getting the test results on my patients finally. So thank you, all you hardworking labs. I'm sure they're running those labs 24/7 to keep up with this demand. Learning curve and getting everybody trained to doing it. They're getting caught up on it. Here is the worldometer. I'm going to hit the update button. And this is the world number of cases. It is still in a log phase here for the world. When you hit daily increase, it's still steadily going up in the world. Logarithmically, these are the Chinese numbers, and the rest of the world got infected. We're still going up. The US, we had a pretty straight log curve. It has curved. The daily increase, I know it was steeper here, a little less steep, but still going up every day. Spain has surpassed Italy as a total number of cases. Their number of cases has flattened out. That gives you a more flat log curve. Italy has also flattened out. They flattened out a little sooner. The numbers are declining of new cases, but people still showing up at the hospital are still going to be rising after that peak, probably getting close to peak there. Germany had a high rate of rise, logarithmic, slowed down and seems to be going back up. France also getting more logarithmic there. Iran had a logarithmic rise, a flattening, and a second wave that is now starting to calm down. That's what everybody's worried about, that we can maintain the social distancing and maintain the pressure long enough to prevent a second wave within the first wave. And there's even another wave that's possible later in the fall after a long break from the summer. United Kingdom still steadily rising. Switzerland, looking into the Netherlands seem to have flattened off. Belgium seeming to flatten off, hard to say. Sweden, where they're intentionally not doing any social distancing as a matter of policy, and they're still steadily going up, whereas their neighbors are not. So Norway flattening off already, and Finland. Waiting for an update on the data here for a second. There we go. Still rising, but not as steep. So everybody's doing what they can there. So everybody, the flattening of the curve is starting to happen for most countries. Eventually it'll start happening for the world, and then we got to deal with the wave of patients. Looking at the map, most of the world's where we're densely populated is pretty red. Africa is starting to pick up, sadly, and they're going to need our help soon. And South America is picking up too. Australia is doing a very good job. Their numbers are very low on the worldometer. And on the worldometer where they track the numbers a little bit different. Here's countries by total cases. But sadly, the worst number to be tracking is deaths per population, with Spain and Italy being at the highest because they got the worst wave. Western Europe had a very high number all across Western Europe. Russia has had very low numbers. They're starting to have an increase in their cases. Hopefully they can keep their numbers low. The world average is around 7. Here's the world average down here. 7 deaths per million. The US is at 18. Germany's doing best of the Western European at 13. Countries doing better than average. Israel's doing very good. Canada's doing very good. Greece is doing very good. Turkey. All these countries are relatively close to each other. I'm wondering if it strains a virus or just the wave as it spreads. Germany did better. It's more eastern part of Western Europe. Poland did even better, and Russia did even better. Is that the wave just hasn't gotten there yet? Because here's Poland's numbers way down here, which is better than Germany's, but not as good as Russia's numbers, which are way down here. So here's Russia's numbers. So it just hasn't gotten there yet. We're not sure. This is a running tally as the numbers keep going up. These numbers are going up compared to numbers even just last week. So that's how things are doing today on April 4th. Everybody needs to keep social distancing. The state of Missouri has done its own ever announcement of extreme social distancing here in Missouri. I'm going to show you what my county has put out as an advertisement. Again, we're still all washing, waving, wiping, and not touching our faces to try and prevent the spread. I'm going to end here with a graph. Wow, I almost touched my own face on video. Our own graph of what our county has put out. That's a very good organized information on what to do and who needs to be careful. I'm in St. Charles County, Missouri. This is from our St. Charles County Public Health. And basically warning the vulnerable populations, people over and 60 and up are the vast majority of the people who are dying from the disease, winding up in the hospitals, winding up on ventilators. It can happen to anybody of any age, but from the numbers I've seen, it's over 90% of the people who are winding up in the hospital on ventilators are over 60. And anybody with a chronic medical conditions, heart attacks, diabetes, lung disease, COPD, asthma, anyone who has a long history of smoking are greatly more affected by this virus. And they break it down low risk, medium risk, and high risk. Again, if you know you have a positive test, you should be in an extreme quarantine. If you're close contact with some of the positive test, or those who are under special advice from their doctor or from the government, do your best to stay away from other people. If you're around other people, wear a mask. I would encourage other people you're around to wear a mask. 2 is better than 1. And if you need help, need supplies brought to you, make arrangements and people can bring things to you. Try not to go out at all if you can avoid it. And some states are even enforcing this. Medium risk, people who have traveled the area, I really don't think the travel warrant is really meaningful anymore. But basically anybody with a test who is pending, or if you're living with a person whose test is pending, you should really do your best, again, to quarantine and not spread. Half the people who have the virus don't even know they have it. So I would consider everybody at low risk, which is not zero risk. If you are around people and they don't look sick, you don't know they're not spreading it. So not to make people paranoid, just make people be cautious. 6 feet distance, wear a mask in public, wear a mask if you're in the vulnerable population, wear a mask if you live with people in the vulnerable population so you don't pick it up and bring it home. So that's the advice from our St. Charles County Public Health. I'm sure most counties are doing their best to keep up. So I'd like to share that with you. So I will have everybody check in again tomorrow, and I'll give you an update of what I know and how I interpret the events. If you are sick, contact your medical advice. If you're short of breath, go to the emergency room and get help and get a proper evaluation as fast as possible. Hang in there, everybody. Thanks. Bye-bye.